Hello everyone and welcome to your ergonomics and chair position tutorial. Now, first of all, apologies for making this video a bit late. So much happening and all. This was planned from a very long time. I thought this would be the first video in my course, but I just couldn't do it. But here it is now. In my opinion, this is the most important video to understand. If you understand this video and if you incorporate this, what I'm going to teach you today, in your practice, your technical hand skills automatically get a lot better. If our chair positioning, spine is relaxed, chair position is accurate, our body works it a bit better automatically. If your chair positioning is wrong, you're bending too much half of the time, your hand skill get affected by it as well. So ergonomics, chair positioning, very important. Let's dive into it without wasting any time. First, let me tell you a bit of wrist movements. I've explained this in one of my videos and a lot of people have seen it. A lot of people actually commented and advised me previously that it has actually affected their skills. And they never even noted and nobody even told them before that it can actually help. Our hand rotates, if you notice, it rotates either this. This is the free-flowing movement of the hand. Majority of the time when we get undercuts and they're roughening, especially at the proximal surfaces, what's going wrong is we're not following the motion of the hand. We forget that motion. We are doing other movements. And you would see that shoulder bit moves, lifts. That's the time you see that your movement's wrong. But we don't realize these things. You're going to learn all that today. So, hand, wrist, left-handed, right-handed. Your hand moves like this. And there's a limit. If you go any more than this, that means, again, see what happens here. The shoulder starts to lift up because the hand has a limit, and now because to reach it, I have to lift my shoulder to go wrong. Likewise, this anymore, see what automatically is happening. My shoulder is rising because there's a limit to it. So make sure, first thing, rotation, focus, this. Anything more, you start to see your shoulder, start noticing it. Same with here, left. Anything more, hurts the shoulder. That's number one. What to do when this thing and this thing incorporates in your practice? Just imagine I'm doing something. I'm doing a prep. And I have to lift this. That means what's happening now, that's the time the body is telling me do this. And it's better. So with ergonomics, what we need to understand is we need to avoid certain movements. Your spine should be nice and relaxed. Your chair should be at the normal position. We're going to talk about that right now. With ergonomics, with forehand dentistry, that's incorporated in dentistry in most of the practices now. Very old practitioners or some practitioners don't want to follow it still. They don't have proper nurses. Trained nurses are still struggling. The majority of the time, that's what's happening. So what we want to do is avoid raising the shoulder. Avoid raising the arms. Avoid your arms going away from the body. So remember, raising the shoulder away from the body and raising it. So that suggests me that this is my patient. I should be working with these sort of movements like this. So just see, shoulders are nice and relaxed. Okay? Working surface, so the lower part of that shoulder there should be parallel to the surface of where your patient's head is. It can't be that your patient head's up there and your shoulder is right there. or your patient head is there and your shoulder is right there. See, I have to lift it to work. So if you notice now my positioning, my shoulders are nice and relaxed. I'm working like this. Anytime I feel like my shoulders lifting or I have to bend too much, more than this movement, that's the time my chair moves and I change my position. Every time I feel like something's going wrong, I change my position. And you'll know exactly when is the time that majority of the time you're working on something. And for example, I'm working on a central incisor doing something, and all of a sudden you need to see that turn and see how my body is moving. Body's moving, body's moving, and then hands almost moving to a limit that my shoulders start to raise up there. What to do in certain position? Easy. All becomes easy. So we studied this in your perio scaling as well, that it should be directed towards where you're working. Your hand should be directed towards where you're working. Anytime it moves, you move as well. Don't allow it to raise and do these kind of movements. You'll see your body's turning. Ergonomics, number one, raising, away, lifting the shoulders, lifting the arms, away. 3 things, okay? Now, when we talk about hand movement, that's the time you realize that how much are you moving, how much you're going away from the body, relaxed, tucked in, not completely like boxing, but it should be tucked in, it shouldn't be here. So it's resting on your body and you're working exactly like this. So you have to do something, you're basically doing this motion. That's how ergonomic works, and that's why we have forehand dentistry. Every time you do this movements and that movements and that movement, that might be not following the ergonomics. That's number one. Wrist motions. Every time you feel this is happening, that means this is telling you to change. This is telling you too much movement means automatically change the chair positioning. It's going to get better. A lot of time when the margin is going wrong, people are trying to do it this way. Why are you doing it that way? Just turn. Your shoulder drops down. It again becomes at the straight line axis. Or chair the position of your head or your chair positioning. Either change the clockwise where you have to go, 9 o'clock, 12 o'clock, 1 o'clock. Either change the direction of this. We'll discuss all the tasks today, okay? Third thing, which is again important, where your chair should be. I love this chair, by the way. I got it from Marketplace, Facebook Marketplace. This is a spine neutral chair, ergonomically based chair. Your spine stays completely neutral. One thing, always make sure you have a back support, whichever chair you have. You don't need to have a spine neutral chair, but follow the same philosophy we're going to tell you today. If you can get something like this in Marketplace, eBay, search about it. Sometimes someone is selling. There's a physiotherapist who is selling this. I got it for literally $50. Search it. You might get one. If you don't, the computer chairs will do. Okay? So first thing, what we need to see is what's the height of this. Now, whenever you get your mannequin heads, chair, always check the position of your table as well. Sometimes people who I go and see demos, their table is this high. Now to incorporate it, the mannequin is this high, and they're literally working like this the entire time, and this the entire time. Or they're so low that they're literally tucked in, and they're literally working like this. Look at how my spine works, how my spine is bent. And if it's too high, look at how much stress my thighs and my hip has. So these things you have to understand. So a normal position should be, when I sit like this, what they generally say is your lower thigh should be parallel to the floor. Your upper thigh or the upper part of the thigh should be directed down towards the floor. So it shouldn't be like have a 45 bend or a 35-degree bend, it should be directing down, so maybe like a 10-degree, 15-degree maximum. And this should be parallel to the floor. Now, this is really hard to check unless you're literally sitting in front of the mirror or I have that camera open that I'm recording the video. So what you need to do is, you need to lift the chair up as much as you can right now and look now. Always make sure you are resting. Don't sit like this, putting more pressure on the spine. You're resting back like this. Okay? What you need to do is, when you sit like this really high and tuck back, resting back, you will see that you have a lot of pressure on your lower thigh here. So instead of doing that technique that you parallel to the floor and slightly downwards like a 10-degree generally, which is hard to know, what you can do is lift your chair up as much as it goes, see pressure in the thigh and keep going down. Keep going down to a limit that you feel that you are resting back as well and you don't feel that pressure in your thigh. And that point when you feel it's actually nice and relaxed, like for me right now, I feel like I'm more on the hip and resting on my hip, not on my lower thigh. My back is nice and stable. I actually have a support there. That's a good position. And that's your check as well. No pressure on your lower thigh. Now, if I feel it's a comfortable position, and you can see me how I'm sitting, look what it shows. You will see that I'm more likely closer to parallel to the floor with my lower thigh, upper thigh, slight bend, or maybe pointing a slight forward, but it's a slight 10-degree. Okay? That's your position. That's your neutral position. Now, as we discussed where your head would be, so for the head, what we will do is, what you need to do is, this head, when you sit straight, rested back, okay, what you should do is that lower arm, when you are nice and relaxed, not lifting, not completely sogging down, back straight, chest up, and then relaxed position. This should be, lower arm should be parallel to where your patient position is. Now, because my patient is completely supine, I'm checking this position. I'm like, it's beautifully perfect. If you are having a 45-degree, when we're doing, for example, a molar, and I'm having that 45 rather than supine, then I would be looking at whichever tooth I'm working in, especially the lower, I should be parallel to that. And if I feel I'm not, and I'm a bit lower, and the tooth is here, that's the time you lift the chair a bit. And now, I'm at a good position. So very important when you sit relax, that should be nice and rested. Back, resting back, shoulders relaxed, lower arm, not sogging down, just relax up. And then that should be parallel to your lower elbow position. That's a good position. Relaxed spine. You can work for 10 hours, 12 hours straight. Your spine will definitely tense because we need break, but you're not going to get backaches and problems. Now, what happens? Candidates get a table first without even checking these things. I always tell them, get the chair first, then get the table. Because according to the chair, you can get the table. And you exactly know where your mannequin will be placed. So you work a lot better. They get the table first or use whatever table they have. Then the positioning can never be better because the mannequin cannot settle here. They either this high, and now just to incorporate to practice, what they do, they get the chair this high. Now see how much pressure my thighs and hip and spine gonna take because I don't have any position or support. Vice versa, if it's too down, then it's so down that literally you're soaking down. That's the time your thigh doesn't take pressure, but your leg bends back too much, and that's the time your hip start to tense up. Because it's not in a neutral position, your whole spine and body load is directly going there. So your legs should not go back. Down, not back. You can do a bit forward if you want to, but then again, you won't have that support. But it shouldn't go that back because you're bending. Like a lot of people sit and they go back, that's different. But to sit down, that should be a position. You can't go too down. Then to work on it, you're soaking down and they start to go back. Hip is getting tensed. So always make sure either get the table and chair at the right table and chair at the same time, or check these things first, where your chair is, where your table is. Because if your mannequin is this high, then you'll be working all the time like this. And I have patients, I have candidates and people I teach who have so much back problems. Some people even end up in the hospital. And I'm not kidding. There are 2-3 people, they have such backache. They ended up in the hospital. And when I went once to Brisbane to give a full coaching to them for a 1-day, 2-day session, I saw their chair positioning and I was like, how are you working? If you work there 8 hours a day, you're gonna be spoiling your back big time. It's not gonna work. So understand these things. Understand this concept that completely up. Forget about the lower border and the upper border if it's confusing for you. If you can get it, great. If it's confusing, slow up till you feel no pressure in your thigh, and you'll see you can rest back. Spine is well supported, and you'll see the time you feel, close your eyes, and the time you feel is completely relaxed, your spine is neutral, and just imagine that your mannequin would be, and just check in the mirror, and you'll be surprised that it becomes that same position. So 3 things: chair positioning, very important, until your thighs don't take too much tension. It can't be too high. It should be nice and relaxed pressure on your hip. It can't be too low that your hip is taking too much pressure. It should be on a neutral position. Your spine should be relaxed. And don't sit like this. A lot of people, when they do it, they start practicing like this. No. Get back. I want you to have that support at the back. Practice this way. Now, a lot of times what helps us getting these movements corrected when you wear these loops. A lot of people, they have to bend even after getting everything right because they can't see. So that's why loops is a must. In my opinion, loops is a must. You will see a video on loops as well. Why is it important? But loops, to get good ergonomics, to good chair positioning, loops should be like essential. You shouldn't be allowed to do it, not because you cannot, because you have so much issues with getting the teeth prepared right, to see it right, and most importantly, to get the spine right, to get the chair positioning right. And it affects you in a big way that we don't even see, because just think, you'll be working, practicing for 6 months, 12 months, maybe 2 years. We don't know. So this should be very, very important. Work on this. So what we've learned is chair positioning, how much pressure, how high. Do you feel something on your lower thigh, or should you feel something on the hip, or you should not feel anything? You should be stable. Doing the movement, you should understand that your shoulders are not lifting, you not have any pressure, you're not raising your arms or anything. Your hand, this and that. Anytime you do more, what happens? Either you're twisting this too much, and to do it, you start to have pressure here, and then your shoulders start to lift up. And what happens? Start to get problems. And directly or indirectly affects your prep or the work you do. You're not feeling it, but it does. Let's see you in the next chapter, in which I can tell you how to do each task, which chair positioning to follow, and which clockwise position do you have to sit in. Let's see you in the next chapter.